Hi, I'm Jean Schumacher, founder of the Plant-Based Academy, where I provide help, support, guidance, and resources to switch to a plant-based lifestyle and get your health back. Today, I have the privilege of connecting with Dr. Sandra Musial, one of the plant docs in Rhode Island, who published 1 month whole food plant-based nutrition educational program that lowers LDL, A1C, decreases inflammatory markers in the American Journal of Lifestyle Medicine. So Dr. Sandra, thank you so much for taking the time to be with me here
Oh,
today.
thanks for having me.
What an article. I'm blown away. You're doing these incredible jump starts. So let's dive in because in your article, you shared some really startling stats. Oh my gosh. Over 50% of the US adult population has at least one chronic disease. Approximately half of US adults have hypertension. 86 million have a total cholesterol greater than 200. 42% of US adults are obese. 11.6% of the US population has diabetes. Why are we seeing these numbers? What's going on here?
And during my 30 years as a physician, these are the statistics that I've witnessed. So clearly, what we're doing in our healthcare system is not working. We've got to change it up.
100%, 100%. Well, you also mentioned the top six causes of mortality in the US. And I Googled this in the 1900s, they were pneumonia and influenza, tuberculosis, diarrhea, diseases of the heart, nephritis. But now, in 2021, the top six causes of mortality in the US: heart disease, cancer, stroke, Alzheimer's disease, diabetes, kidney disease. Why is there such a difference between the 1900s and today?
I think a lot of that we do have to credit our modern medical advances of vaccinations and antibiotics, because many of those causes of death back in the 1900s were due to infectious diseases. We now have better sanitary conditions. But the flip side is that our food supply and our lifestyles have gone downhill over the last 100 years terribly. So now we have a lot of products that are called food, but wouldn't be recognized as food back in the 1900s. And if you think about what the definition of food is, which is a substance that nourishes the body, promotes longevity in a population, these food items that are found, probably 70% of what's found in the supermarkets, in my opinion, don't qualify as food. But this is what Americans are ingesting at fast food restaurants, convenience foods. And even like you take a real food, but then it's bastardized and added sodium and fat and oils, and it's processed and macerated so that the original substance is no longer even recognizable. And then we add chemicals and grow it in soil that's deplete of healthy organisms. Yeah, we have severe nutrient deficiency amongst Americans. It's an epidemic of micronutrient deficiency and fiber deficiency.
It's so true. And it's so true. And I saw this, I was in the classroom teaching for almost 40 years. And I saw this in the kids and seeing what they're eating. I was subbing for a while in the schools here on Cape Cod, and I'm appalled at what the kids are eating. It's just nothing but processed garbage. How can your brain function on that? And we see it. I see a lot of depression in the kids. I see a lot of problems, digestive problems. And it's the food. It's food. So.
Yeah, and I worked at a pediatric obesity clinic for 3 years. I helped start with Dr. Corcoran at Hasbro Children's Hospital. And the kids are they're all obese in that clinic, and a lot of them have these secondary diseases like fatty liver disease, hypertension, lipid disease. They probably even have early coronary artery disease and fatty streaking. But these in their most there were a lot of poverty, but these kids were not food insecure, they're nutrient insecure. So they have access to enough calories to maintain their weight, but these poor kids, they're malnourished, even though they have the weight. So you typically, when you think of malnourished kids, When I was growing up, we would think of very skinny population Africa that wasn't they weren't getting enough protein or calories. That's not what's happening in America. They're loading up on these processed, ultra processed foods laden with unhealthy carbs and fats, and it's leading to this nutrient insecure obesity epidemic.
Well, based upon the growing body of evidence supporting whole food plant-based to improve health, you decided to do these 1 month intervention programs called Jumpstart Your Health. Tell us about this program.
Yeah, I was super motivated after working in mainstream healthcare to start Plant Docs because as hard as I tried, this whole food plant-based nutrition approach, preventative approach, is not valued by the healthcare system. So I did leave mainstream medicine. I started this nonprofit called Plant Docs, and our signature program is called Jumpstart Your Health. For 1 month, what we do is immerse people in the world of whole food, plant-based nutrition. We educate people why the standard American diet has led to all these chronic diseases and perhaps the chronic disease that that individual is struggling with. And we educate them on how to plan meals with whole, nutritious, plant-based foods and how to cook with them. And so 3 of the days, so it's weekly for 5 weeks, and 3 of the days is educational and really kind of the basics of, well, what do you do with a bunch of kale, and how do you read this label? How do I find a hummus that doesn't have oil in it? How do I plan my plate so it has enough protein and iron and calcium if I'm not going to be having milk and beef? And then 2 of the days, we literally virtually, as we cook together and make a breakfast, lunch, and a dinner. And we teach people how simple it is and how delicious the food can taste. We teach them how to make sauces and dressings that are oil-free, that make the most basic, like rice and beans and broccoli dinner, be delectable and tasty. And then what sets us apart from most programs is we're all MD led physicians. So we draw blood work in the beginning and we assess for inflammation, diabetes, lipids, fatty liver disease. And then at the end of the program, we repeat any labs that were abnormal. And so from the beginning, starting in July of 2019, I've been collecting data, and we've published our article in the American Journal of Lifestyle Medicine that you mentioned, showing the significant and profoundly impactful results that we've been having on individuals.
Wow. Well, what tests did you specifically do? I mean, with blood panels,
Yeah,
C-reactive?
so we do a fasting lipid panel that includes total cholesterol, LDL, HDL, triglycerides. We do an AST, ALT, which are liver enzymes that look for fatty liver disease, which is now the most common cause of fatty liver disease is obesity and excess weight and calorie intake. We do a fasting glucose and a hemoglobin A1C, which is a marker of short and long-term excess glucose and insulin sensitivity or insensitivity or resistance. And we do an HSCRP, which stands for high sensitivity C-reactive protein. It's a mouthful, but it's just an inflammatory marker that is a little bit more specific for cardiac disease. The most powerful thing is it's a short-term marker, so we can look at it at the beginning and the end and see the impact of eating an anti-inflammatory diet, which this is, a heart health diet, which this is, an anti-cancer diet, which this is, and an anti-diabetes diet. That's what whole food plant-based is. It nourishes your body, your cells, and your gut biome to be the healthiest it can be. So it helps fight off all these chronic diseases. So we did it for 1 month, and when we saw the results of the participants after the month, there was 2 other doctors and myself, we were blown away because we didn't think like we just threw this program together, with a lot of thought, but we didn't realize like how impactful in just 1 month it could be. So I was hooked and I was like, that's it. I don't need my other career. This is so rewarding and so impactful. We need to keep doing this because
Right.
nobody else is doing it.
Right. Well, and I remember when I first started this journey, my blood work, my C-reactive protein was pretty high. And so I said, listen, I want to do blood work in 6 months and I want to redo my C-reactive protein. She said, why? I, because I want to see what the change. No, no, it doesn't change. This is what it is. This is your new normal. It's not going to change, and it won't. And I've never seen it in my 25 years of practice. It just climbs higher. And I'm okay. Again, I'm gonna try this, and I want to do my blood work in 6 months. And I did it, and of course, my C-reactive protein way down, almost no inflammation. And she said, "Oh, it must have been bad blood work."
I
I get no credit for this, none,
know.
zero. She's now, because I'd worked with her for years, before I moved up to Cape Cod, and she finally realized that, hey, yeah, diet does have an impact on this.
Yeah, we have a lot of work to do with the medical community, the medical students. It's
I know.
it's a slow
Yeah.
process, but it's happening.
Well, okay, it's time to glow. Share some of the results that you had. Wow.
Across the board, like even for people who didn't have abnormal values to begin with, we had significant drops in total cholesterol and LDL and inflammatory markers. But it's for the people that came in with abnormal labs to begin with that they dropped their cholesterol 40 points, their LDL 22 points in just 1 month. The inflammatory marker that you mentioned decreased 32%. Blood pressure dropped 10 points from the beginning to the end, and they lose about a pound a week. It is not a weight loss program, and I don't even believe in that. I believe in nurturing our body and the health of our cells. And when you eat food that nourishes you, you just get to a healthy weight. So it's not about body size, it's about being healthy on the inside. But one of the most profound impacts is on insulin resistance and diabetes. I've had people before the program even starts. I've worked, sometimes when people are real newbies, they want to do a consult first and start making changes before. And I had one woman who had type 2 diabetes and elevated cholesterol, and she was in the obese category. And the only thing she did, she said, let me just start by cutting out meat and cheese, but I'm not going to do all that other stuff yet. I don't want to do kale yet. And she just wanted to cut out a few things. And a week later, she needed to reduce her insulin dose because her body didn't need this extra insulin that she was injecting every day because she's making insulin. Her cells just couldn't use it. It couldn't utilize it because her receptors were all bogged up and not working properly. So just like taking away this food that was acting as a toxin for her just starts to wake up her cells and helps her body to start functioning again. So in the month long, sometimes people come off their insulin completely. We have to be careful because they can drop their blood sugars when their body just starts working. They don't need this medicine anymore. So that's, I think, one of the most joyful and rewarding patients are the type 2 diabetics or the pre-diabetics because it can be improved so quickly. When I was at that pediatric obesity clinic, a lot of the parents were not healthy, and a lot of them had type 2 diabetes and obesity. And I got to a point where I was asking every single parent when they came in with their child, I'm like, I know I'm supposed to be taking care of the child, but has your doctor ever told you that your type 2 diabetes is reversible by changing your diet? And not one person said yes. They were all like, what do you mean? I didn't know that.
I know.
And that's what, oh, I'm like, this is not right. I feel like everyone should have that option. Everyone should have this choice. Do you want to change your diet or do you want to continue on insulin and these medications, these statins, these blood pressure meds for the rest of your life? They should at least be given a choice and know that they could make a choice with their fork to eat healthier.
I
But
know.
that's not even happening. So it's so frustrating. How do we reach these people? How do we reach the doctors
Well,
and
and
the individuals out there that do want to make a choice?
it's true. And I'm so grateful Dr. Clapper is going around and talking to medical
Mm.
students.
Dr.
That's,
Clapper is amazing. Yes.
oh, he's just the most incredible person. And, He was actually down at Plant City in Providence, just a few weeks ago. So on his tour, he was going to Brown at that point. So I'm just so grateful that he's doing that because he's reaching the next generation who's now going, yeah, no, we need to change food and change.
Yeah. So in our Jumpstart, we have 5 spots every month that are free for the Brown medical students to join or the residents. And they take us up on it. And we had 6. Even though we only have 5. We had 6 last time joining in. So, and they're learning. And some of them are learning for their own, knowledge so they can apply it in the future as physicians. And some of them are already sick from the chronic standard American diet with chronic diseases and want to help themselves. So that's wonderful. So I'm so glad that they're taking advantage of that opportunity.
Oh, that is so awesome of you to do that, truly.
And
So,
just so you know, with Dr. Mariah Stump, we do co-lead a course called Food and Health for the Brown medical students. And we have 20 to 40 people do it each semester where they get some lectures on healthy nutrition and then they cook at Johnson& Wales University and learn to make different foods from scratch. So it's a step in the right direction.
oh, that is so awesome.
Yeah.
Well, you're continuing these programs?
Every semester. My lecture is on whole food plant-based nutrition and the reversal of cardiovascular disease. I give the same lecture every semester, and Mariah Stump does one, and yeah. So
Right? Well, but the educational programs that you do that are the jump starts, the monthly jump
mhm.
starts, you're continuing to do these, I'm assuming.
Yes, yeah,
And where can people find out information about this and to join? Can they be virtual or does it have to be in person?
great question. So they can be done fully remote, or sometimes we offer a hybrid if people are local. They can do the nutrition education part in person at Plant City in Providence, Rhode Island. And the cooking classes are always remote because I want people in their own kitchen. We send out the ingredient list and we cook along together. So it's not a cooking demo. We want people stripping the kale, chopping it up, dicing their own onions, sautéing in veggie broth, and seeing that they're going to live without the olive oil. Um, and they're amazed that they create some of these foods that they didn't know that they could cook. So they're offered across the country for anyone. Since COVID, we made the option to be fully remote because we didn't want germ spreading and then it became more of a demand. People wanted to do it that weren't local. So now every program is a hybrid. So there's some classes where I have half the people on Zoom and half the people live in the room, and we're all learning simultaneously.
That's
And
awesome.
all of the information for our jump starts can be found on our website, which is plantdocs.com. And
Awesome.
we also have monthly cooking classes that are similar to what I described. And I do private consultations for people that want more of a one-on-one help and assistance, which can be in person at Plant City or remote.
That's awesome. That is awesome. Thank you for taking the time to share and glow about your stats.
Thank you. Thanks for having me.